So who seconded it, Dottie or David?
I
Let's
did.
do Dottie on this one.
Okay, sorry, we're recording now. Motion. And David. Okay, all right, now you can vote. Thank you. Sorry about that.
Okay, so a vote to approve the minutes.
Motion to approve.
Proof.
Take a vote. You just voted. You
Yeah.
made the motion. Now you just,
Yeah.
you gotta
Oh.
call on everybody?
Yeah.
Since we're not here.
Okay.
Approve. Aye.
Approve. Dottie.
Yeah, yes.
Okay, David. Vote to approve the
Approve.
minutes. Excellent. Okay. So we'll move right along to what's that? He's kind of frozen.
You're
in and out a
frozen,
little
David.
bit.
You might have to turn your video off.
A pine tree might be hitting your antenna. Well, you might be out. I'm not sure. Is he still
No,
there?
sometimes with these, if
Oh, there he
you
is.
can hear them, if they took their video off.
Oh, okay, good.
So we have, Paul Kirschner from Stamsky here. This is the definitive subdivision. Last time we met, we talked about the preliminary subdivision. It was the same address, the same, if you're thinking. But now they're coming forward with the definitive subdivision. I'm gonna turn Paul, and I recommend that we approve this, the board approves this, but I'll let Paul answer any questions you guys might have.
No, this had to do primarily, if you could just refresh us a little bit on is this the drainage?
It's suitable, is the site suitable to be used as a 2-lot subdivision?
Yeah,
And we went out and did soil tests. You wanna talk, Paul, let you,
there was an issue with turtles too, but that wasn't really before us, but I know like it's a breeding ground for the turtles, and then there was some question about whether there would be adequate space for a runoff.
correct. Do you wanna speak to that, Paul?
Yeah, absolutely. So for the record, Paul Kirshner from Stamsky McCanary, we're the engineers and surveyors for this project. I'm going to share my screen because I think it's a little bit easier if we're looking at the actual plan that we submitted. So this is an application for a definitive subdivision. Last time we were here is a month and a half, 2 months ago, before the board. So the definitive layout that we've submitted is extremely similar to that the board saw a while back. I'm going to zoom in here in a moment. I'm going to go back to the first page just to show the cover sheet. So Garrison Road comes off of Bedford Street. There's really only 3 houses on Garrison Road, and this property where the proposed development is at the end of that road. So what we have is 2 lots, roadway with a T turnaround, and each of these lots are proposed to be served by individual septic systems. Town water is proposed to come into the site to serve the houses. So it's really just the septic systems that that the Board of Health will be reviewing at this time. We did conduct soil testing at the site, and it's all good sands. So less than 2 minute per inch perks, definitely suited for septic systems. This will be reviewed by the planning board. The engineering department will be reviewing the stormwater drains for this site. And yes, the property is within habitat of a turtle species, which is the hatching that you see on this plan, the diagonal gray lines is basically the protected area where we are not proposing any alterations. So that's why, although this is a much larger parcel than you typically see for a 2-lot subdivision with 20,000 square foot zoning, we're only proposing 2 lots. So septic systems are right here. I'm trying to trace that with my cursor. If you would like to hear any more detail, I'm certainly willing to provide it, but I think that this project is pretty straightforward, from a septic perspective, and it is pretty much the same as what we presented when we filed the preliminary plan.
It's pretty straightforward. Does anybody have any questions at all? No,
No.
I guess we can take a vote on whether to approve or not, so, I'll start, I guess, I vote to approve,
You need a motion.
motion to,
I'll make a
Vote.
motion to vote to approve.
okay, do we second that?
I second.
Excellent, okay, so, I guess we'll go through, aye, we'll vote to approve,
I.
motion. And David,
Aye. Yes, aye.
okay, looks like it unanimously passed. So we approve,
Thank you all.
you're welcome. One. So I know we had another item, but that kind of
It
was
got,
taken
it was
off.
taken off because the sale did, possible sale did not go through, so they did not, they withdrew their request,
Okay,
okay?
excellent.
So,
So I guess we'll go right to the chair and board member reports. I do not have anything to report, but there is an issue, and I was wondering if maybe we could bring it up now as far as going to the, if we can get some, maybe people that might be available to go to the chairs breakfast meeting.
are you getting the emails for it?
I am,
When is the chairs breakfast?
I'll have to check to see when the next one is.
Okay,
Yeah, but I'm wondering if there's, anybody,
Tuesday morning or Wednesday
I
morning?
thought it was Wednesday mornings.
Okay.
And I think they're pretty, they're once a month,
Mhm.
they're once a month. Eventually, everybody will have to
Yeah,
give some time and go to them. Just because of my work schedule,
yeah.
I'm
Are they? Are they like?
Wednesday, like kind of early, like their first
The
thing.
chairs breakfast are the like 8,
Yeah.
9 o'clock.
I mean, it's a good opportunity to kind of see really what's going on in the
Yeah.
town, all the different chairs get together and they kind of discuss the latest business. It's,
I mean,
Yeah.
I'm pretty flexible with advanced planning.
oh, okay.
Cause,
I've been to
Yeah.
one, it's really interesting to hear all the kind of the scoop from the other departments and to kind of give an update of what we've been addressing and see what piques their interest.
Yeah, I think with the one I went to, there was a lot of talk about the school and busing and the shelter and where those kids are getting, getting access to school and whatnot. So it really was kind of comprehensive and it was, it was really interesting.
yeah, I'd be happy to go to one, but I just would want, I just have to like put it
Yeah.
on my calendar, block it off, figure out.
So maybe I can put it out there, then I'll
Yeah,
look
maybe
back with the
email.
next, and then I'll just kind of
So why don't you
Send
send
it.
me the date and then I'll put it out
Okay.
and then people can,
see if somebody might be able to pick it up or someone's off.
Right.
I'm off on Fridays, but I'm never off on a Wednesday. I think they usually almost always fall on like a
Right.
Wednesday.
you can discuss directly, like, it's not open meeting if it's just one, you're just talking, but if you wanna email the whole group, you have to. It's open meeting, so I'll send out a message and then you can,
Okay,
okay?
okay. Any other board member reports for? Anything going on with the 2229 Main Street project? Is that David's? Who's David going? David, do you have any report on that?
Not really. The work at the site has been in preparation for the really key step next year, which will be putting the wall around the holding basin. I don't know whether they have this summer injected, they inject iron down into the holding basin that's got some goo in it to, wait a second, turn off my video. Can you hear me cleanly?
Yeah,
Yeah, much better.
Okay. Yeah. The holding basin has some depleted uranium in it, which is immobilized by the iron injections. I don't know whether they've done that this summer. Next summer, they will build an underground wall down to bedrock around that site. The cleanup people and the EPA have been going back pretty much all set. And the 2229 committee has just kind of been watching. There hasn't really been anything that merits any attention.
Excellent. Thank you, David. and Thank you for covering that. I guess the next item is the public health nurse report.
Yes, I can give that report. So more included in the packet, an update on the communicable diseases for June and July. There was 2 tables. In general speaking, we have in the summer months, we're on track for normal intake or increase in enteric illnesses. So Campylobacter, Salmonella is very common this time of year to have higher incidence of those. We still are tracking on point high levels of Lyme disease. And are looking at a number of different other tick-borne illnesses in the community as those get diagnosed. We did provide some outreach to our colleagues in the buildings and grounds. There's a packet here, a little pouch that has a tick removal, a tick identification guide. You're welcome to take one with you. They have a little magnifying glass, how to dispose of a tick. We are passing those out. They have been out on the table. We supported our colleagues in building and grounds to have those available, but we're just trying to do some information outreach on ticks. We have like a scarecrow that is an informative display about ticks with some handouts, and the Pollinator Health Committee is gonna bring that to Ag Day. So they reached out to me. They presented at a library event at the end of June, but they're going to take the tick display with them again on September 6th for Ag Day. So looking forward to that. Maura's been very busy into July with camp inspections. We also did some outreach and kind of messaging on mosquito awareness, because we did have some samples not last week, but a couple weeks prior, starting the end of July, test positive for West Nile.
Has that gone down a bit?
It's gone down, well, for us in this community, but other communities get raised. So there is a good interactive website that Maura linked in her stuff, if you wanted to follow that, like we're all tracking it, we're all keeping track. There has only been 1 human case of West Nile, but and typically starting in September as the nights get cooler, this total number of mosquitoes really falls off. And we saw that last year with the triple E risk.
Yeah,
And we haven't seen the triple E.
yeah, I feel like this summer has not really been.
Not the same. Maura has been serving as the Council on Aging substitute a little bit this summer, as their nurse was on leave. So she has a weekly like office hour there. Starting tomorrow, Thursday, we are going to, if you turn around, I have a poster here. We are with partnership with Middlesex Bank and the Behavioral Health Collaborative, going to have a display on opioid overdose and some flags and some just outreach for mental health in general. But that's gonna be a display right there where they put signs at Middlesex Bank, right there in
That's
downtown.
nice.
So she's been working on that. We continue to work on our behavioral health improvement plan. We're not quite there. I've had no admin since the beginning of July, so we are still kind of trying to fill that position. So and she's worked a little bit to confirm up and get an employee and Council on Aging flu clinics.
Okay.
COVID is still, I think today it did come out, the CDC's recommendation is not for adults under 60 to get the COVID shot, but
Right.
that will remain to be seen if that means they're insurance eligible. There's still a lot, but that was news today. So we are offering the flu and COVID if it's available. And working with the school department to set up to park immunization clinic for the teachers. We certainly have one for town employees and for the COA scheduled. Any questions on public health nursing?
The only thing for the behavioral health, I'm just curious, cause the poor high schoolers who experienced all that. Are we, as like the Board of Health, doing anything to kind of support? I don't know, I can imagine like back to school, like that whole
So
end of year.
Right, so we are working, we have that relationship and a contract,
Oh, right,
with the behavioral health clinician or
Yeah.
the community clinician.
yeah,
And we, we're trying to reach out to the schools to set that up,
okay.
right?
Yeah.
They're trauma informed and DEI informed, trained, all the staff
Yeah.
there. Juliet J is the clinician that's for under 18, and Laura Page is going to be for over 18.
Mhm.
But we're trying to promote that as an option,
Yeah,
as well as, in some of the materials, the all of Emerson's like available resources. So all the mental health resources, all what actually is available, because
Yeah.
that's one of the barriers, is just knowing where to
Yeah,
go to
yeah.
get what you need.
totally.
But we're kind of monitoring that and working with Emily Block, so the police department does a lot of work and trying to understand what the school department might need for support.
Yeah, okay.
Okay.
Can I ask a question about the COVID vaccine recommendations?
Mm-hmm. You
Melanie?
can, I might not know the answer, David.
Yeah, well, no, none of us do because Kennedy is changing what happens at the CDC. Their director of 3 weeks just quit this afternoon, in part over the vaccine recommendation issue. So I know that several states, public health departments have,
Did we lose you?
have talked about getting together to, and I didn't know whether that would ultimately bear on us. I know nothing's been done with that so far, but I didn't know.
My understanding is our DPH was waiting to see what CDC, and I think that came out today, this afternoon. I saw the headline about the recommendation. Not unexpected, but I don't know what DPH, Massachusetts DPH is going to say. I mean, I might know in a couple days, I might know next month, but I think our plan was to go ahead with the flu shot and offer COVID when we can, if we could.
My question, I guess, is more succinctly put, if the Mass DPH ultimately recommends something other than what the CDC does, how do we figure out what to do?
We will find out what is covered by insurance and be clear and transparent with what, because we don't have our vaccine supply from the state. We use and partner with other partners. So we use Sodino from Acton Pharmacy. And so he's not gonna give free vaccine. Some health departments get free vaccine from the state and they administer vaccine. We'll pursue that option, but right now we don't have a vaccine cooler at our own supply of vaccine. She went over to Bedford today to talk to the nurse there. They have a vaccine cooler. Could we get state approval to transport is something called a VeriCore cooler, so it keeps it controlled temperature, even though it's a cooler. We're investigating what our options are, but I don't have a definitive plan right now because we didn't know what the guidance was. Traditionally Concord hasn't had the need for under vaccinated, right? People have access to either the pharmacy or their primary care provider or some other way to get anybody that wanted the vaccine has access. We do support a little bit of homebound and offer, just because of transportation, at the Council on Aging for the older adults and kind of as a courtesy employees. Right.
I guess we don't
We
really
haven't-
need to discuss it
What's
much
that?
further. It's a policy question. Should it arise if there was a conflict between a DPH recommendation and a CDC recommendation? But that's for us to mull on. There's nothing that needs to happen tonight.
And I can't, whereas I don't have funds and resources to pay for a vaccine, right? We don't have a budget to pay we don't get, some towns get free for underinsured. They have a source of free vaccine. And we might be able to tap into that, but we need to know that they can't get it. Right now, everybody who wanted it could get insurance coverage, right? And it could be paid for. So we didn't have that problem. So it's to be determined, David.
Okay,
We
thank you.
don't know. We really don't. It's kind of like
Yeah.
public health right now. We're doing the best we can and
Back to being on the front lines.
Yeah, Yeah. it's
Um,
different.
It's definitely different, you know, I do think public health has always been science-based and informed, and so some of the stuff that's coming out is a little, you know,
Different.
correct.
I mean,
Um,
I suppose we could go with our numbers, but by that time, you know, from the town, I'm assuming that we're all gonna be reporting
so we,
COVID numbers.
we had, you know,
And if people are even.
not the highest level of COVID numbers, if you look at, we had, 12 cases in July, 6 cases in June. But the data right now, there's a different variant in the south, like 10% of people getting tested are testing positive for COVID. Right, so that's not in Massachusetts right now, but more south, schools 2 weeks in, I mean, they started school earlier. The other thing is we have a limited number of COVID tests left. We have been offering and giving out free COVID tests since I've been here. But that's going to end. We have less than 40 left between the library, the council on aging, and our office, and then when they're gone, that's the end. There won't be any more. So we've been just giving them to anybody, no questions asked, take as many as you want.
Yeah,
And that's not, I mean, I, again, don't have funds. That was a free through the state, through the federal government funded program, and it's not going to be funded
and they
anymore.
expired too.
They do expire. We did have some challenges with moving them, and we figured that out. Since Maura came on board, how we work with partners to distribute, we have the right amount and their expiration. We figured that out. But in the last year, we've always had a steady supply, and we get more in and they're not expired. It's worked pretty smoothly.
Yeah.
For what demand is here. But I won't have people, if the COVID comes around and people are going to come in the fall and look for free tests, I'm not gonna have anymore.
How often do you see people coming in asking for the tests?
It's a steady stream.
Is it
Oh, yeah,
still?
yeah, we move them.
Yeah.
We'll get
It's
a
probably more
couple
testing
cases
of
in,
what's
and
going on.
it's just, they're free instead of paying, what, are they $20 or
Yeah.
$15 at the grocery store?
Yeah.
Or the CV, you can get a free one here. I mean, you're just being frugal.
Yeah,
Yeah, yeah.
that doesn't necessarily mean they have an issue.
You know,
I had
Yeah.
a quick question. Any thoughts on underreporting of COVID? So I had COVID, as did my husband, in June, and we knew 2 other people. That's 4 Concordians in June, and I'm sure it wasn't, weren't
yeah,
4 the
you
6th. Any thoughts on how the factor of underreporting? I'm
I
just curious.
don't. When they're testing in some towns, they can detect it in feces, they can see the spikes, it's a
Right.
better indicator of the number. But of course, people, if you're not sick enough, this is only, the communicable disease report is only those who went and got tested in Maven at their primary or somehow got tested and got entered.
Probably sick enough to.
It might not even detect other diseases. It's only norovirus we talked about a few months ago. It's, if you don't go,
I mean,
even it said
that's-
there was 2 all of last year. Is that true? No, it's
Yeah.
only 2 went to the doctor and tested positive, right? Certain
Right.
things are reported higher percentage because tick-borne diseases, you tend to need antibiotics for. If you don't get better in a few
Right.
days, you
Yeah.
go, you keep having a fever, you had a lot of malaise, you get tested, but with most people, with norovirus, you get sick, you get better, you move on, you don't go to the doctor, because that's
Yeah.
of the symptoms. The ones that we do get case numbers for are what we call our congregate care, so any nursing facility or,
Mhm.
Mm.
I called my primary and let her know that both my husband and I had COVID, because I was hoping somehow the disease surveillance system would, it would be entered into that. I thought it was important that she know, even though we didn't go to her office to be tested, but.
Right,
curious.
usually the numbers we're here are, those are confirmed cases, and she has a little asterisk here, and that's kind of what it means, right? When we do the year-end report, there's 3 types of, there's confirmed, probable, and suspect
Oh, okay.
that come through Maven, and she doesn't report every month because sometimes the suspect, they don't know that's a suspect.
Mhm.
So I don't know, that would have depended on whether or not your doctor entered that.
Yeah,
And if
I'm
you're
just
really
not-
curious, you can call Maura and see if you're on the list.
I'm very curious if that,
If that
that's
happens.
filtered down into the
Yeah,
system.
if that was your intent, then I would, call her directly and ask her, cause I don't, that's a.
Yeah, that is a good question, like, where is she getting these numbers? Like,
Through Maven, through the disease reporting network for the state, so that's where any tests comes through. So your
okay,
primary care, your minute clinics, anywhere, the hospital, there's like 90 diseases that are considered reportable that get entered in. And those, you're seeing of the 90, the ones that are in Concord, right? That's not, there's a whole long list of other diseases. These are just the ones in the last 3 months that have,
I'll put up with those, with
You know,
our,
that she's monitoring
Postal code.
and dealing with. She does not respond typically to Lyme. And works, the state usually handles most of the TB cases, and coronavirus, we're not following up with at this point. But anything with Campylobacter, anaplasmosis, she does follow up for communicable disease control, tries to speak to people, understand what they do for work. If they work in a food, they're excluded, shares that, talks to them about what they need to do. Maybe if they're open to it, how they got this, where they might have gotten it, what precautions to take. Sometimes it's like hand washing, cold food holding, like just general communicable disease. She does a good job with it. It's just sometimes people don't want to talk to the government about their illnesses.
yeah.
So it's subject
Dottie, are you,
to,
your husband okay? Or how badly were you ill?
Neither hospitalized, fever about 100, 203 with body aches and chills.
Oh, wow, that's pretty high,
Wow.
that's really high. When was this,
Uh,
June, you said?
June 26th.
Oh,
Yep,
wow.
and we know how we got it. We had 2 house guests from Manhattan and they brought it with them, so we know exactly how we got it.
Oh, no, yeah.
Better now? You recover okay?
Yep.
Good.
But
Oh,
I'm
good.
just, I am gonna follow up because I am just curious again, so that if something were to happen, that our numbers can be as accurate as possible.
yeah, I just think it is underreported. If you don't know you have COVID, there has, or you don't test and you have those sniffles and you don't go to the doctor, it is definitely
Mhm.
not a representative of the true number of disease.
I know we don't test in the hospital, like if someone's not feeling well, but we don't necessarily test them for COVID. We'll maybe cancel their surgery and send them home till they feel better,
Right.
but we don't really have a definitive number, so it's probably 10 times, if not 20 times higher.
I believe the word is endemic. It's considered widespread in the
Yeah.
community, just
Yeah.
like any other.
Yeah.
So it's not something that where of course we'll have infection control and congregate care, and we want people and work if they have too high of cases in the schools, but it's not something that
Yeah.
we're treating it like we do the flu.
In the early days, we test, somebody wasn't feeling good, we test them right away, and then those numbers would go in, so we had a much more accurate count
Right.
than we do now.
Yeah.
Now it's like, oh, you're not feeling it, oh, a little fever, okay, we're gonna
It's
cancel you.
just like the flu, so
Yeah.
it's not really differentiated.
Unless
that's
there's
him.
reason, unless they're requesting, or something, it's not something.
I will say, I don't know if we should be prepared for this, but, in the community of people with young kids, people have been going to the doctors and asking for their primaries to vaccinate their kids now, cause they're worried that like vaccines aren't gonna be available.
All vaccines or COVID
Yeah,
vaccines?
like, no, like even general vaccines, like what's gonna get
Really?
covered, what's not, yeah, parents are just like,
Hmm.
I don't know, I think there's a lot of concern about what's gonna be, I think that was maybe a few weeks ago when there was that shakeup on the board of, what was it,
It's the CDC committee
Yeah.
that run
Yeah,
vaccine.
yeah, so honestly, like, I don't say that for any purpose other than to say, like, I can imagine a world as like things in the media pick up where the Board of Health like might just want to be prepared if we need to like, do a primer on here's what's covered, here's what's not, don't panic, like, all the vaccines that you need for your kids on COVID are still available, I don't know, I don't think we need to do anything right now, but
I don't think we know enough right now.
that's what
It's
I
very
mean,
like.
yeah. But I
evolving.
can see a world as, whatever, as like this whole thing can unfolds, that people will
Yeah.
start asking questions.
I think our stand should probably be to get vaccinated, like to,
Oh, yeah. I mean,
like if you have, if your child is scheduled,
Right.
we're
Follow
always
your
gonna be like,
primary care.
yeah, get vaccinated. I think that will always be kind of a
The-
smart stance.
The biggest thing will be whether, was it covered by your insurance?
That's right, yeah,
And the cost.
Mhm,
right,
mhm.
cause it's, right, that's what it is.
You
The
haven't had to
vaccine
pay,
payment
that's-
doesn't
Right.
cover it, right, exactly.
So childhood vaccines have been no cost for forever to anyone.
Mhm.
And that is through the federal government, right? So that supply, and so it's just how is, like we discussed earlier, is the state going to move money around, but then it's not gonna fund something else? Like,
Right.
what is the priorities? Like, how's that going to work? Will that insurance companies still cover it if it's not mandated by CDC? There's a lot of things that are just going to unfold, but I don't have answers.
We don't have any.
We don't have
visibility,
answers
yeah.
for today. I think, depending on the cost of the vaccines, you could say we want them to be vaccinated, but if it's cost prohibitive,
Right,
then it's, taking people that are more economically sensitive to, it's a struggle.
Mhm.
There's another question though that this is raised, which is the issue of general vaccine safety, which is now being thrown into doubt under a political cloud, unfortunately. As COVID was, for example, at the beginning, everybody was all for vaccinating, and then it got polarized, and then the anti-vaccine thing grew. So at some point, Melanie, I would encourage us and you to think about having just general answers about vaccine safety available to the public should any arise.
Okay. Yeah, we can, I mean. There's a lot of information out there, but I think that we can revisit,
Yeah, there's a lot of
we
information.
had a message, we had a good messaging campaign last year we put out, but we will continue to.
yeah, I can envision it being a little bit more intense this year, I think.
That's the issue. So there's a lot of information out there, but the question is, in terms of risk communication, is which sources will you rely on and which ones will you trust? And I would think that the local Board of Health would be a high trust sort of source. So just having that in the back of your mind for all the stuff that's brewing would probably be a healthy idea.
Okay, that's good. Well, that's good. I think that's feel free to reach out, during, you don't have to only talk to me once a month. You can say, if you have something that comes up and a concern in between, you can email me and we can, I read that update right before this meeting. So literally today,
Yeah.
right? So I wasn't prepared for,
No, I don't
Feel like
think
a lot of
it can be. I think it's all, I feel like every time I open my phone, there's something crazy going on with the health. Or anyway, but
Melanie,
anyway,
can I ask a
think
question on a previous topic? The issue of undercounting of disease.
Mhm.
Suppose there's a spike in something or other that we would care about. Is the state the primary source to first see those? Because our system has got a delay built into it. How would we know about that sort of thing?
What do you mean in other communities?
No. So some new thing comes along, or all of a sudden there's a big jump in Lyme, or there's a big jump in something that it would take us a while to know about through this number reporting that we have, regardless of whether it's statistically accurate or not, I think is secondary. But how nimble, how responsive is it to new stuff that pops up?
So Maura works very closely with the state epidemiologists, like
Okay,
almost every day.
there you go.
When anytime a case comes in, and they can come in through Maven through a number of ways. They might come in and it's a probable through a hospital visit, and then it goes to the lab and comes back a couple days later, it's confirmed. Like, so that when she's reviewing all the like, it's like a hit, if you will, if you will, like this is what's come through. And they come from doctor's office, from the state in different ways, and then they get cross-checked. And the epidemiologists at the state are watching, more is watching, and if there's ever a question, sometimes there is a lag, but sometimes it's pretty frequent. So it's not a perfect system, but it's disease monitoring of what we have right now.
Reassuring.
Right, and I think
I'm a rookie at all this, so that's reassuring.
yeah, so she works, so especially with things like Campylobacter, anything that we consider could possibly be a foodborne illness, we really work to find, or water contamination, like where could that be happening? Okay. So we keep track, of those types of complaints. They might come directly to our department and we enter them into Maven. They might come to another health department. So, and those get entered in as well. Those aren't necessarily confirmed cases, they're just a complaint. And then we usually say to people, go to the doctor and get tested so we know what you might have. That helps us, try to, essentially have good prevention so other people don't get sick.
Thank you.
Right. Now we're gonna be moving along to your report.
My report, okay?
Director's report.
So we had a busy summer.
Yeah,
Everybody got done the end of or beginning of July. She took a job in another community. So we've been searching for an admin, working well with our HR department. Right now, every municipal department is working on their capital budget. So for FY27, so for next year, preparing what we want to ask for capital. And we will be working on our annual budget in September. And that's the budget items that go through FinCom and then get voted on at town meeting. We had a good amount of new food establishments get permitted in the last month, really. Pyramid Health is the recovery center. Chipotle's got a food permit. Little Eva's in Wisconsin, and Starbucks is on Elm Street is going to be permitted or inspected on Friday. We have a plan review for Sally's at Pizza. That's just the preliminary proposal for what they want to build for that place on Elm Street. So we've been pretty busy with new food establishments. Planning on taking the APOD out of White Pond next week.
how's the next week?
Yep, that's the plan. This week is the last week for bathing beach water quality testing, so we stop after Labor Day, because chances of people swimming are less and less as it gets cold. Doesn't mean they can't, it just means that we no longer have water quality result. And as the temperature goes down, also the chance of something being present and multiplying is low because the temperature gets less. We have received an application from the Best Western on Elm Street for them to reapply and open back up as a hotel. So that happened this week. There've been some questions.
It's gonna be a lot of work.
I was gonna say.
I don't know.
Yikes.
We will re-inspect, they applied for hotel motel campsite permit, so we will go in and inspect, as well as a food permit, so we will do our due diligence before we issue those permits. Okay. That last thing I guess I wanted to talk about, I mentioned it a little bit earlier, we are going to have a display we're putting up tomorrow. It'll be up for 2 weeks on our opioid settlement monies. How we want the community to have input, like we want the community to tell us how they want to spend the rest of the money. There's a display showing in Middlesex County it'll be flags. I encourage you to take a look at, who just kind of representing that people around us are, dealing with opioid overdose, and sharing awareness and where resources are. So I printed out a lot more of those surveys. I encourage anybody to spread it to their communities. And I really want a cross section of people. Like, I don't want people to say, well, you didn't ask me what I'm concerned about when it comes to opioids, or do I want youth prevention, or do I want, I'm trying to get as many people to say, well, what do you want the money to be spent on in Concord?
Got it.
We are spending some of the money on Olivia, the prevention coordinator. Okay, so some of it is going, and our behavioral health collaborative voted on that, to say, hey, let's use this prevention coordinator. And she's put a big calendar together, and September is Recovery Month as well as Suicide Prevention Month. So in our Great Meadows region, there's a lot of programs, classes to take, things that we're kind of sharing out. So I think I sent it out before this meeting. You may not have looked at it, but I did send it out to you. It wasn't ready I was on vacation. It wasn't ready for the packet, but I did mail it all to you. We'll, working with Donna to get it out through the website, out into the greater community. But if you have any feedback or hear questions from people, or, anywhere you can have ideas to spread the word or get feedback, that'd be great. And that, I think, is all I have. Now I'm open to questions.
Okay, what time frame in that 267 lives lost? Is that
The last year,
just last
since
year?
July to July, so it's a year.
Oh, wow, okay. And each purple I can't really see it, but it says.
Oh,
Those
it's
in
Middlesex
community
County.
alone, or?
Correct.
That's.
In
Concord,
Middlesex County.
Middlesex County.
So Concord did not itself have opiate overdoses
Okay,
last year. We had 11 prescription or over-the-counter medicine overdoses, not necessarily deaths, but we have calls that are documented. So in Concord, it was prescription medication or over-the-counter medication overdose, so an intentional overdose. So that's connected to mental health and other things.
is that poison control also? Like, if someone calls poison control, will they report those numbers to us?
That number is about police calls as they recorded them. Right?
Yeah.
So but there are people that have substance use challenges in our community, right? And we want people to have awareness and feel supported and not have a, high level of stigma. We want them to
Absolutely.
get help and, sort of.
I have one thing to
Mhm.
bring as a totally, it's related but unrelated.
Okay.
From what I've read, like, which is great, that young people are not engaging as much in like illicit drug use. However, what I've found out is like they are cranking these Celsius drinks, which are like really, really caffeinated. And I had the experience where I was at Dunkin' Donuts. I did not know that these like pink drinks that they sell have like a tremendous amount of caffeine. And I was like, sure, you can get one, thinking it was like, I don't know, I thought it was like
You like,
a
you got one?
juice. No, my daughter was like, I want that, and there was a little girl in front of it. I was like, it was whatever, early in the morning. It was just called a refresher. Like, there was like
Yeah.
nothing that would indicate that this was a caffeinated drink. So I've talked to other parents about this where like, and I've noticed it in the stores around here, like they keep all these energy drinks that are like very branded towards kids, like Ghost. Celsius is like branded to make it look like it's a health drink, and then these pink drinks. And kids are like having like 4, 5, 6 a day. I know that there was some like legislation in Florida that they just passed about energy drinks, because obviously Florida is like the home of all, addiction epidemics, but just something like for us to have on our radar, because I feel like we dealt with like
Flavored tobacco.
flavored tobacco, but I'm it is very clear that there's this crazy marketing play right now to make highly caffeinated energy drinks appealable to young kids and teenagers. So whether that's like, I don't know, like even just a warning, not a warning, but like a notice, like, hey, this drink that looks like a
Fun
juice
drink, yeah.
and is marketed towards kids has a severe amount of caffeine.
Yeah,
You might not wanna let your 5-year-old drink it, you know, and I didn't know.
Just a case like that, was it Starbucks? It was
Well, there's
something
a
in the news.
there's a bill in Florida because a kid had a heart attack and died.
Yes, and he went into a Starbucks and it was a
It
drink.
was one of these.
I don't know if it was
They call
Starbucks,
them
I'm throwing that out there.
refreshers,
Yeah.
but it's like more caffeine than coffee.
Yeah,
Um,
like significantly, like.
significantly more,
one of
and
those power drinks.
and I noticed, should I even in like Concord Provisions, they have this like whole display of this Ghost. It's called Ghost, and it's a energy drink, but it's like right at eye level for like,
It's a little one.
so, yeah, I don't know, it freaked me out. You know,
Yeah.
I
right.
can imagine like parents who don't have really nervous spouses being like, my husband was like, you know what it was? I was like, what? And he was like, this caffeinated. I was like, what? And so, I mean, there's no way, there's no reason you would know.
Sending your child to school on her first day ever.
Yeah.
Jacked up on an energy drink.
And thankfully it wasn't today.
Well, it is,
Talk about mental
isn't
health.
that what, isn't that what the kindergarten teachers give the kids at noon to keep them
Yeah,
awake? for the-
exactly. They're like, you don't get nap time anymore, kids. Here's your refreshment.
She did her entire year of work
Yeah.
today.
But I can see it, like, from what I hear, kids are kind of abusing it like they did with Adderall and like that whole thing. Like in high school, they'll have like 3, 4, 5 of these a day. And so it's something we should probably just like, I don't know, this was new this happened this week to me, so now I'm more
Well,
attuned to it.
as a mom, I'm aware of, I would call the use of those drinks,
Yeah,
in teenagers,
Yeah.
for sure.
yeah,
And you know, if you are subject to a heart condition and you.
Sure.
Then you do like a sport event or
Yeah.
something, you are, you know, putting yourself more at risk and they're not thinking of that,
No,
right?
and they're gearing
Anyway,
it towards these kids who are like, you know, whatever, between 10 and, like, if they have like pop stars, like holding them in so, anyway. Something to
yeah,
noodle on.
absolutely.
well, I'm wondering if there's any like data about it.
Well, I know that the whole Florida thing, like, I know that the state of Florida is doing a full audit of energy drinks and labeling, and I think some have to put a warrant, somehow Celsius doesn't. But you have to put a label warning now. So I think this is gonna be, you know, the equivalent of flavored tobacco, right? It's just
Mhm.
like the new marketing ploy by, you know, big food. So, I can see it becoming an issue.
Okay. Well, I have 2 things on my list, that's
Yeah.
good.
There you go.
Yeah.
Don't get a refresher, that if you don't want caffeine.
All night, all right,
Yeah.
excellent. So that's the end of your.
That's all I had for updates, and if, unless there's any other questions.
Does anybody, I know that this is probably a good time, because I think, you know, as being the chair now. You know, we talked about it a little bit about, does anybody else have anything that they'd like to put on this year to like kind of see us kind of tackle, or at least go, you know, talk as a group about? Seems like we have kind of a quiet moment now to kind of discuss it. I know we talked about, and I just have this one thing about. It seems like with all new developments going in, about utilizing the groundwater. Did we ever come up with anything? Like, are we absolutely barring groundwater use with the exception of irrigation?
No, I mean, we didn't. Our well permit, so we updated our well permit, last year,
Yeah,
but we did not. Limit we didn't put any controls on it. Because
okay,
the feeling at that time by the board was that the state was going to come up with some sort of regulation. And be very hard for us to locally enforce.
Okay,
So you can dig a groundwater well, but you can't use it for irrigation unless it's the same frequency of the town water, supply. It just wasn't going to be, something that we could, how would we control that? Because a lot of people, there are residents in Concord, they dig an irrigation well because the water cost
Yeah.
from the municipal supply, so they
but then
dig.
they're taking it from the overall.
That
source.
is, the more we get into droughts like we have now and what it's going to be, that's a conversation that's going to continue to evolve.
Mm.
With water supply, water quality, like it's already there in some states.
Yeah,
And certainly. But at that time, water and sewer did not have any recommendations and we didn't go down that road.
okay.
Mm.
I'm just wondering, because they're gonna be putting in a new, stormwater. Ordinance, I guess, where,
Mhm.
and I'm just wondering if we have any input, like, as a board, we'll probably have some input with that at some point in time. If it's well water tied in with stormwater tied in with septic setbacks from sensitive areas and that
Mhm.
kind of thing. You know, I know we have stuff on the books now, but is there?
So we could look at, and I don't know, our local, we have, so there's Title V, and then we have the
Mhm.
Concord Board of Health septic regulation.
Mhm, mhm,
But I haven't, stormwater is not under our purview,
okay,
okay? Unless it's, it has to be managed, so it's not like, if you have like a stormwater system, you have to have setbacks for
mhm,
your septic, but it's not something that's usually overseen by engineering or, so we don't have jurisdiction, right, as a Board of Health.
I'm thinking around like White Pond too, since we kind of had that. Issue come up that kind of got taken down. For this week,
Okay,
I kind of was doing a little thought on it, do we have any? Say in whether people should be kind of reporting their maintenance and that should we have the homes around? Sensitive water bodies like
You
well
could-
water.
so you
and
could
hot
pass-
Water,
so the Board of Health
swimming water,
is allowed to be more strict than any state code under what you have as a Board of Health has purview over. So you can develop a stricter, regulation for like septic systems,
mhm,
like, requirements like they have at the Cape for nitrogen reduction, sensitive body water. We made it a policy as a board, but you could make it a regulation.
okay. What would we
Um,
need to do to be able to kind of move towards getting a little more strict around some of these?
you say, Melanie, we need to research this and we try to we'll find out what's out there, find out what's legal. I work with town council, we come up with a draft, we discuss it, we edit it, we come back with another draft.
Okay,
And then you post it and vote on it, have a hearing.
okay,
So it's kind of like, I guess, understanding what the goal is. Like for me, like, what are you looking for? Is there, there are towns that have more strict. We have, Natural Resources Commission has, bigger buffer zones, right? We have a, 75-foot setback instead of a 50.
mhm,
Right, from wetlands, that's not the state, that's a local regulation.
mhm,
So there's some already increased controls in Concord.
okay. The reason why I bring that up too is because we were vacationing this past couple of weeks at Winnipesaukee.
Mhm.
And they're starting to have some water quality issues in that lake and
Mhm.
I was reading a little bit about it and some of it was construction around. Water bodies, the water body itself, newer construction. Another issue might have been, fertilizers and things on lawns
I
near
was gonna say that.
water bodies. And I'm just
Golf
thinking,
courses.
a lot of times, I was thinking of how successful we've been with the A-pod. And there was a lake, I guess, Kennesaca that was having that we used to vacation on years ago. And they had huge problems with blue-green algae the last few years, and I kind of read through what they were doing. This is what I do for fun on vacation, but they were saying, you know, some of it has to do with runoff.
Mhm.
And then another, and I didn't, nobody mentioned the pollen.
No.
But I think that's a huge component of it, obviously.
For White Pond, that's
White, yeah.
right.
But I'm also wondering, like, getting more strict with, you know, around our swimming ponds. About maybe having some sort of like, you know, that residences that are within 75 feet of this should be reporting to the Board of Health their scheduled maintenance, or whether they've complied with scheduled maintenance or not on their septic. And whether or not we should maybe start looking at banning some stuff around
Pesticides.
waterways, like fertilizers, and, you know, if you're 75 feet and there's no fertilizer at all, if you're
Yeah,
back even further, maybe you can't use this type of fertilizer, but you can use this, you know, an organic fertilizer, and then
Mhm. Okay,
just. I don't know what you guys think of this, if you guys wanna tackle something like this while we're. It's kind of a pet project of mine,
cause.
yeah,
Yeah, I mean, obviously, and then unfortunately I have to scoot in a minute, but.
Yeah.
I was reading about, there's all this new research on golf courses and the fertilizers that they use, and that like homes. Within X percent, X distance from golf courses, like have much higher incidence of like certain types of illnesses, and they're thinking it's tied to fertilizers in the
Sure.
water. So I don't know, I don't think you're the only one thinking about that kind of thing.
when I feel like we're kind of in a position where we might be, I mean, it's not gonna make you very popular amongst certain people in the town.
Yeah, I was gonna say, I think you might
But I think it's
keep
something
some
that,
people.
as long as we're here, we might as well start thinking about it, especially if we're, you know, I guess we would have to think about which bodies of
Well, I
water.
think if we
would
keep it,
disqualify.
like, what's the goal? Like, is this in the side, keep it science-based? Like, what are we?
Right.
What are you trying to make sure they maintain their septic system? Or they, provide a. There's some models maybe down at the Cape that there's, needs to be functioning within so many feet. Okay, you have an existing house, we're not gonna you can't tell somebody, oh, sorry, you can't have a septic system anymore.
No,
But like, what can you do?
but what's the, like, I think with, like, if you go to, cause I'm on septic, obviously, and I know that the recommended through vendors, like, what is their scheduled maintenance? I think it's every 2 years you have to have it.
Well, it depends on what type of system you have.
Right,
So
right,
one of the projects that we are working on, and I don't, we're working on it, is, so some septic systems are called IA technology.
mhm,
So that stands for innovative and alternative. So they're not traditional. Those are the ones that may have nitrogen treatment, like a Presby system, or there's a number of different ones. And so what Mike's been working on this week is and the regulation is from DEP, if you install one of these, they have an O&M, an operation and maintenance. You're supposed to have a contract as the homeowner, and you're supposed to comply with it, so it works properly. And you're supposed to share with the Board of Health that you've complied with this.
mhm.
And we are gonna work on a project where we follow up and track that.
Maybe we can include homes. in
So,
other areas
That's in the code, that's in the existing code, that you're supposed to do that, but to date, we get them and we put them in a log, but we haven't, maybe. Jim Whalen, the Board of Health hasn't received your O&M since 2023. And you're supposed to do it every 6 months, so what our goal is to send out a letter and say, we haven't received this from you,
Right.
and you must comply, right?
Yeah,
That's something that we know we could do more on. It just hasn't been of all the things priority, right?
yeah,
Getting trained staff, getting, working through getting permitized to work and dealing with, but
or if
that's.
we have addresses that, of people that
So when they're installed
fall into
as
that.
new septic systems and they're approved by the Board of Health to be used, and that type of system is requiring an O&M, then it's connected for like the life of that system, that you're supposed to have contract with a company to do that and report the results to the Board of Health.
Yeah,
And, sometimes people, if they don't grow up in septic, they might move here, they might not know.
Oh,
They might not understand.
I moved here, I was like, what?
yeah.
I've
I'm the same way.
I've had a few residents like call me and say, well, do I have to do this? And I'd be like, you bought a house on septic.
Yeah.
Yeah,
Yes, you need to pump it.
Well, then
Yes, you
you
need to
also
do your O
wonder-
and M, you know.
how many are out of compliance, or how many people are living on failed systems that are just, you know, and they know, oh, I never knew I had to do it. It's 20 years later and they've never had their system that needs to be pumped.
Well, I mean,
So it floods the backyard or something like that. No, it happens, I would imagine, right?
it can, the soil here in most of Concord is what I call very forgiving. It's sand.
Yeah.
And if it's overflowing, the soil is treating the septic, so it's not
Mhm.
getting, as long as they're not in the high groundwater area. When it was so wet,
2 years ago.
2 years
3
ago?
Yeah,
we had a higher rate of failed systems, because what was happening is people's septic systems were literally getting called hydraulic failure.
Mhm.
They were getting too full of water, so they weren't draining, and then they were getting backups and pooling and having, we had people were like, you know, call their plumber, because what's wrong with I can't flush my toilet, it's backing up. Well,
Yeah.
it was because there was so much high water that their system, the leach field couldn't take the wastewater anywhere. So we did have a couple of those, you know, that's tough, because it
Yeah.
was so abnormally high water. So I think there's some models around the Cape with, you know, I guess my question is, what would be the goal? Like, if you're gonna write a regulation, what is the health and safety that you're looking to protect? So if it's, and does one already exist, or is it under the Board of Health?
Hmm.
You know,
I
if it's-
suppose swimming and drinking.
yeah,
And especially, I mean, what would happen if we have like, say on 117, that big development they put on 117, which is right on one of our wells. Like if they're using a lot of fertilizer and pesticides to keep their grass looking great over there. But if it's downhill from, I know there's probably been water studies and people say that it isn't, but it kind of is. Like kind of backdoor to our well, how would we enforce another jurisdiction or another town? Is that even possible? Like, could we enforce, well, you guys can't use
well, that gets into,
fertilizer?
it's DEP, so no, so you have
No.
control as the local Board of Health, what happens inside Concord.
Inside Concord.
You'd have to sue it.
Oh, we got a lawyer.
Yeah, you.
But I-
What is it? Quiet enjoyment.
So the Mass Association of Health Boards, a couple years ago, we sent out the handbook,
Okay,
all the responsibilities of boards of health. And that's kind of a good legal document that it shows you, there's a lot, there's like, what is your responsibility as a local board,
mhm,
okay?
From our training too,
Right,
which I did.
did you do it? Good job. So I think, you know, under the guidance of a well regulation or Title V, you have authority to be more strict than the state code,
okay.
okay? But I mean, my suggestion, my recommendation would be, we find evidence and science why, what we were trying to
Yeah.
do, like, what's our goal?
Yeah,
Okay,
otherwise
Like-
it's flat, yeah.
well, you'll set me up to be, you know. I'm not afraid of being unpopular if I'm doing the right thing to protect public health.
Yeah,
I'm not,
But there
but
needs
is it
to,
necessary?
is it like,
Is it a necessary step?
correct, and is it going to be effective, and what is the goal and the purpose of it?
Okay.
Would be
So
my take on
big
it.
concern, sure.
Not that we wrote the well regulation, we were more strict than a lot of
Yeah.
towns, and,
Were you guys all here for that part last year when we did the well?
oh, I
regulation.
think so, yeah,
You were here, right?
yeah,
Mhm.
Yeah.
Yeah.
I didn't think it was that long ago.
No.
All right, I guess moving along, public comments, doesn't look like anybody's here from the public, so I guess we'll make a motion to adjourn. Unless there's anything else anybody wants to mention, no, okay,
motion to adjourn.
motion to adjourn, do I have a second?
I second.
Okay, we'll adjourn our meeting until until September.
You gotta vote.
I vote.
I vote, yeah. All
I
vote,
vote.